Welcome to Everyday Nursing Knowledge Lectures, and today we will learn how to identify right and left bundle branch block in EKG. To identify blocks, know the conduction pathway of the heart, which starts from SA node. The SA node generates impulse and it transmits to AV node. From AV node to bundle of His. Bundle of His divides into right and left bundle branch and finally into Purkinje fibers. The bundle of His transmit impulse to left first and then right. So septal depolarization starts from left to right, and then both ventricles, right and left ventricles, contract simultaneously. So if there is a block in the right or left bundle branch, remember it causes conduction delays in the ventricles. It can be identified in the QRS complex in the EKG because QRS represents septal as well as ventricular depolarization, and it can be identified through precordial leads. Precordial leads are placed in the chest, that is V1 to V6, and it gives or records the electrical activity of the heart in the horizontal plane or front view of the heart. Normal QRS complex is 0.12 second or 3 small box. In right bundle branch block, there is a block in the right side. So remember, septal depolarization starts from left to right. Since there is a block in the right side, left ventricle contracts first and then right ventricles. So if you look at the V1 is on the right side of the heart. Remember, any time an impulse moves towards the same side of the lead, it creates a positive wave. If the impulse moves away from the lead, it creates a negative wave. So first depolarization starts from left to right, that means towards the lead. So in V1, it creates a positive wave. Then left ventricle away from the lead, so it creates a negative wave, and then right ventricle and it creates a positive wave. So in V1, it gives a RSR pattern. Now V6 is located in the left side of the heart. Again, septal depolarization starts from left to right, away from the lead, so it creates a negative wave. Then left ventricle, a positive wave, and right ventricle away from the lead, so it creates a wide S wave. So in right bundle branch block, V1 gives RSR pattern. This is also called bunny ear or M-shaped pattern. In V6, it gives wide S wave or a W-shaped pattern. And also the QRS will be greater than 0.12 second or greater than 3 small box. Now in left bundle branch block, there is a block in the left side. As a result, right side septal depolarization happens first and then left. So septal depolarization from right to left, block in the left side. So right ventricle depolarizes first and then left ventricle. So in EKG, in V1, which is placed on the right side, depolarization moves from right to left. As a result, it moves away from the lead, so it creates a negative wave. Then right ventricle towards the lead, so it creates a small upward wave. Then left ventricle, so again a downward wave. So it creates a wide negative QS or RS complex or a W-shaped wave. Now coming to V6. V6 is located in the left side of the heart. So first from right to left, so it creates a positive wave. Right ventricle away from the V6, so it creates a negative wave, and then left ventricles towards the left, so again a positive wave that gives a broad notch R wave in V6 or a M-shaped pattern. So remember, the mnemonic for right bundle branch block is Morrow, M for V1 and W-shaped pattern in V6, and left bundle branch block is William, that is W-shape in V1 and M-shape in V6. So today we learn how to identify right and left bundle branch block in EKG, and thanks for watching my video.